Okay, good morning, everyone. I think we will get started. I know some others will be joining us. There is a lot of traffic out there, but we appreciate those of you who got here on time. So without further delay, we would like to get started. I'd like to welcome you. Thank you for coming. I just want to say I don't think as an industry we've seen as many challenges and changes as we are currently experiencing. But I do want to share with you some information regarding the CMS reform of requirements for long-term care. We did include in your packet some comments that we've made on these changes. We encourage you to comment as well. Share your comments either with Greater New York directly, or you can email your comments to CMS electronically. Okay, not sure if anyone in the audience got to read the 400-plus page document, but we have. Okay, so we've summarized it, we've sent memos to our members, and although some of the requirements are resident-centered and involve quality care, some are burdensome and will be financially heavy impact on the industry. So we do want to share that with you. We encourage you to make comments during the comment period ends October 14th. Okay, and in your packet you can see the comments that we've put together regarding these reforms. So just to give you a quick overview, see if I got this right. As far as why are these changes coming now, CMS has indicated there hasn't been any changes to the Federal Register for nursing home participation since 1991. We now take care of more complex patients. We have technology as a factor, electronic medical records. So these are the history behind the changes. Okay, some highlights include under infection prevention and control, which we already do in New York State. We already assigned someone this role, but we want to bring in the antibiotic stewardship program as part of the proposed regulations due to multi-drug resistant organisms. They're looking for more judicious use of antibiotics. CDC has supported this, so this is one of the regulations. Not all of these are negative, as I said, and many of them facilities are already doing. The pharmacy requirement is a bit burdensome because it wants a pharmacist to review a resident's full medical record, not just a drug regime review, every 6 months when a resident's on an antipsychotic, an antibiotic, when they're readmitted or transferred from a hospital. So we have commented in our comments that that needs to be re-examined because that could be very burdensome for facilities. Resident assessment and care planning, baseline care plan within 48 hours of admission, not so new. Technically, many facilities already do many of these protocols in New York State. So it's really just reinforcing some, incorporating the nurses' aides into the care plan team and meetings. This has been proposed. Many facilities have tried to do this. They've indicated there's scheduling problems, trying to have the certified nursing assistants actively participate in the meetings. This is something you need to re-examine and plan for because this is one of the proposed regulations. Competencies, staff training and competencies, ensuring that your staff has the right skill sets for the jobs that you're asking them to do. That's nothing new, but the competency-based approach will be like a documented competency base that facilities will have to indicate how are they training their staff in caring for the residents that are sicker, residents with dementia. There's also increased focus on antipsychotics. There's a new section under the regulations for behavioral health, so that's another focus. Again, these are in your folder. You can look at our comments and give us any feedback. QAPI, we've been talking about for quite some time, so that's not anything new to facilities as well. We've already encouraged you to begin the quality assurance performance improvement process that's proposed. It's actually an excellent process for QA, and again, not something new. We've done quality assurance for quite some time. Lastly, the good news, there is some good news in the proposed regulations, and that would be that dietitians and therapy providers would be able to write their own orders under the supervision of a physician rather than always having to wait for telephone orders or wait for the doctors to get involved. So that's a positive. Including respiratory therapy as part of rehab services would be excellent for many facilities because you can incorporate those minutes into your therapy minutes, so that's a positive. Many facilities, as we said, have already been incorporating these programs. The CMS comment period is still open, so please make your comments, send them to us, or send them electronically directly at the website given. Again, these are proposed regulations, so we do have time. Once they are become regulations, we still have a year to implement them, so that's another positive. Start to plan now, look at the proposals, break them down into what your systems need to be reviewed and looked at with your staff. And lastly, that we will be here to inform and assist members throughout this process. Okay? Then without further delay, I would like to bring up our Executive Director, Michael Balboni, to share with you some industry updates. Thank you.
You can applaud for Mary. She does a great job. Thank you very much. I look at the screen and I kind of laugh because when Mary sends me emails, she always includes some little thing on the side, like the smile, so we could be talking about something really intense, and she always puts this little, icon, this little emoji. I appreciate your emoji sensitivity. Ladies and gentlemen, thank you very much for joining us today. What we're going to try to do today is just a little bit different than we normally do. This is really kind of a call for participation, not just in terms of coming here to these seminars, but the government at the federal and the state level is looking for our input. And, just to step back for a second, before I got into this industry itself, when I was with the governor's office, I was dealing with issues of homeland security and emergency management, corrections, and all that kind of stuff. And having been a legislator, of course, I was very involved with some of the nursing home issues. But I always had this sense that the government knew what it was doing before it got started, that there was a set of rules, and this was all agreed to ahead of time, and they're going to come out, and it's almost like Moses coming down with the tablets. Here you go. This is how you comply. I've since learned that it's not like that at all, that it very much is an iterative process where they come down and they have goals, they articulate policy, but the implementation is really, with the old saying, where the rubber meets the road. And so oftentimes, you either get a good result or a bad result, and I'm convinced that which result you get is dependent upon how much participation you have from the users, from the end users, from the folks who are really charged with the responsibility of taking care of people. So today, you've heard me give updates in terms of where Albany is and what's going on with the legislation and what the governor's office is thinking. Today, you get to literally hear from the guy who is making these decisions. John Olberg will be with us later on. And he's really the guy who has been put in the position of trying to make the implementation make sense. And so he's coming here to give us an update, but important in that is that you also give him some feedback. Now, please don't turn it into a boo, hiss, throwing stuff party. Let's not do that. But I think that your engagement, whether it's at this moment or at a later time, is very important, as is this. So if you take a look collectively at what CMS is trying to do, there are some things that are good, as Mary pointed out. There are some things that are very bad. For example, there's a requirement now that they're proposing that before any patient can be discharged, there must be a nurse who says, yep, you can discharge, or a doctor. So it's 2 o'clock in the morning on a Saturday, and you discharge, and now you got to get a professional come in who's not on staff? Is that really doable? Is that, are there any other way we could do that? We need to have a feedback. Maybe this is the call to, really look at programs like telemed. Maybe this is something where we institutionalize that and get a reimbursement rate for those types of services. But it's that if you can pay attention to some of the aspects that you find troublesome and then respond to CMS, that's very, very important. As Mary Gracie White said, we have a time of change. You've been seeing this. So what we're trying to do is, your association, is try to take some steps to give you some tools that perhaps could be of help. And so one of the tools that I've been working with and the board of directors has authorized me to do, and Judy Dicker we have here, she's on the board, is that we have retained counsel to assist homes with negotiations or understanding of negotiations with managed care companies. The firm is by the name of Rifkin Radler, and they're out in Long Island. Frankly, I think they give Wall Street benefits at Long Island prices. So they have counsel to us now that they're going to provide specific information as to discussions with managed care, both as to the initial contract discussions, as well as if you have issues. For example, it's a Friday afternoon, and a patient comes into your shop, and you can't get anybody on the phone, managed care company. Well, now what do? You can call us, and we can put that connection here together. We've also taken a step to kind of bolster our labor negotiations, regulatory affairs, and understanding of government. Kind of somebody who's going to support what Robin Rosen does on a daily basis, what Mary Gracie White does, and what I do. And so what we've done is we've reached into the governor's office and the Department of Labor specifically, and we pulled out somebody who I've gotten a chance to really admire over the years, who is, in my opinion, one of the last of the Mohicans in the governor's office to truly get stuff done. And I'm going to introduce you to her now. She's going to be available for questions as they relate to regulatory affairs and the processes that are in the government itself as it relates to DOH. Rachel Gold, would you mind joining me here? We can give her a nice warm welcome. Rachel, why don't you just give us some of your background, if you would.
Sure. Thank you. So, yes, the unfortunate truth is that the governor and everyone in the office is human and puts their pants on one leg at a time, as my father would always tell me about people that I felt somehow intimidated by. So I'll tell you about me, and then we'll come full circle to why I hopefully can be helpful to all of you. I was a prosecutor way back when I got involved in government, working for the Senate minority as a chief of staff. After going into the private sector, I then came back out and went to work for then Attorney General Andrew Cuomo. I was an assistant attorney general, and I handled, I was basically director of operations of the Attorney General's office. But during that time period, we had Governor Spitzer and Senate Democrats who were leading the Senate, yes, the Senate Democrats were in control. And there were a number of laws passed that criminalized certain behavior by employers vis-a-vis their employees. And Attorney General Cuomo wanted to put together a unit that would enforce these rules and kind of develop cases that would, that would make an impact and bring these labor laws to the forefront of the community that was now being regulated by them. And having been a prosecutor and having to, being within grabbable distance, I ended up starting that unit and did that for a few years. I then went with him to the governor's office when he was elected. And when I left about a month ago now, I was special counsel for labor, as well as the deputy commissioner for legislation, policy, and federal affairs at the Labor Department. I will also mention that in my free time, which isn't much because I have 2 small children and a couple new jobs here, I am also state chairperson of the Women's Equality Party. And I mention that because the point is that my relationship with the government and the number of capacities in which I've been working with this governor and his administration does put me in a unique position to understand exactly what Michael is saying, to support what Robin is doing, to support what Mary Gracie White is doing, which is all of these things that they keep putting out there, and they want you to be responsive to, or be regulated by, rather. They are human beings who haven't really figured out how that's going to play out. In many instances, they haven't actually worked in the industry, so perhaps they don't see all the practical implications. In other cases, they may just not understand how it relates to other obligations you have. That there are many, many agencies that fall under the executive, and even the people in the executive offices oversee several different agencies. So what I am hoping, and what I know is in fact the case, is that all of this information, all of these proposals are in their infancy in many ways. And we are uniquely positioned to actually affect how these things are going to regulate us. My father's a small business owner. I grew up in Brooklyn. He turns 80 tomorrow, and he gets up every morning at 7 a.m. and goes to the shop and falls asleep at his desk at 11 p.m. And so I understand that you have to run your business and be regulated. And this administration, part of the reason I work so well with them is because they do understand that, but they don't have the expertise necessarily to know what the rules should be or what the implementation steps should be. So thank you for a few minutes of your time, and I look forward to working with you on actually making this productive.
Thank you very much. Thank you. So now in your checklist of things that might come across your desk on a daily basis, you can say, all right, so the state's issued new regulation. What does that mean? Call grader. There's a question as to the labor relations call grader. I'm not sure what the government's going to be doing as it relates to this in a call grader. And lastly now, I have a labor issue with the Department of Labor, call grader. So we're trying to bolster out the benefits of being a part of this association. So 2 last points. One of the things that John Olberg is going to be talking about is the Advanced Training Initiative. It is something that we've been speaking about. We were able to get a commitment from the governor and actually put it into law for $46 million to offset some of the wage costs of a contract. But of course, inherent in that is that there must be training and a continuous care component to increase the quality of care. And John will be talking about that, but what we're going to hear in just a minute is Sandy Vito from the 1199 Funds is going to come up and talk about how that training is going to look like. How is it going to work and what's it going to look like? But before we get her up here, I just wanted to make a comment, and that is that when we did the negotiation, both for National Benefit Fund, which is a smaller series of homes they call the Group of 44, and some of you may be there, maybe not, and also Greater New York, which is obviously a much larger group. We predicated the conclusion and resolution of the contract upon the receipt of the $46 million into the system itself, because we felt that this was a partnership between the state, labor, and management. And this was a very appropriate, they've done it in the past, so we did it there. Of course, with all things, there is the devil in the details. And the detail is that though the contract for the National Benefit Fund was settled, I think, Robin, last May, we'd set timelines for wage increases, we put in a provision that said if the money had not been received by the time that the wage increase was supposed to be there, we're going to hold off. So that's, you may hear a little bit about that from some of your employees, but that's kind of where we are with the National Benefit Fund. Now, Greater New York, the wage increase isn't due until later, but again, you'll hear from John as to what the timing, we think the timing is hopefully the receipt of the money by the end of the year. So it's still kind of a moving target, ladies and gentlemen, and there's still, hate to say this, there's still an opportunity for friction, but we're going to do our best to try to make sure that that doesn't happen. But that's why John's comments are going to be so important today. So without further ado, Sandy Vito from the funds, please come up and tell us how you're going to make it all smarter when it comes to the quality care we provide to our residents. Ladies and gentlemen, thank you very much.
Good morning. Wow. Let's try it again. Good morning. Good morning. Better. So I don't know if we're going to make us smarter, but our goal is to make it easy when it comes to the Advanced Training Initiative. So I'm going to start with that, even though that's in the middle of these slides, so we won't have the benefit of the slide. But I think many of you may have received a letter recently that there is an application coming out. The application for the Advanced Training Initiative is relatively simple. It will ask you some information about what training you want to use and what your consistent staffing configuration is presently. Our goal is to do 2 things. We're sort of taking responsibility for supporting you with respect to the training part of this. So our goal is to do 2 things because there won't be, despite what a lot of folks think, lots of money, because we know that this commitment is for this to go into the benefit fund for this training. So our goal is to say, well, you have to fill out this application. So 1, we will give you application assistance, and 2, you actually have to deliver the training. Now, I believe everybody in the room is a contributing employer to the Greater New York Education Fund, yes? Right, so I'm positive that you are. So through your contributions, we will make available to you training. And when we do we're going to hold a meeting to go through the application, hopefully once the application comes out, which should be within the next 2 weeks, and a webinar so that if you can't make it to the meeting, you'll have assistance via the web in filling out the application. On the application, it will be very clearly marked, as I understand, that you can select our training. That will be the cost-free option. So the training is intended to support CNAs in identifying potential indicators of resident decline. So very similar to some of the Interact. our goal is to take some of the tools that already exist, put them online so that the training can be done online, so that you won't have to create classrooms on site. So it will just it will make it very easy for you to deliver. And so one of the things that we want to do is create a small work group to understand, well, what is the easiest, most effective way for you to deliver this training that won't interrupt your operations? Absolutely. So, is everybody clear about that? Because I'm not sure if there's clarity in the way this is structured. Yes, questions? Yes, please. That is the plan for a couple of reasons. One, and we do want to create a work group on that. Our understanding from talking to a lot of the homes in the past is that if we were to send a trainer, you have to release workers and that it becomes an operational disruption. So we want to put quality content online. We understand quality is important, but we also want to make this as least disruptive as is humanly possible, because we know that really you want to be able to do this effectively, but expeditiously to be able to meet the state requirements. Does that, now, I'm going to go through a whole bunch of other training that we have that you can take advantage of that's longer and more in-depth. But for the advanced training initiative, because the goal is really that this is a reduction to your benefit costs, this is intended to create less stress on the facilities while delivering quality content online. Does everybody understand that? Questions? I feel like, sure. Because I feel like there was a lot of confusion and I'd like to hear about